All right, so if we move to the first topic, the COVID-19, this virus that emerged at the end of December in 2019 and has had such a devastating health impact in these last few months, and is now reaching a really serious crisis point for us all here in America. And if we go to slide number 6, a key point for all of us to be aware of are what are the telltale symptoms of the coronavirus. Well, it is what's called a respiratory virus. It's one which does affect primarily the respiratory system, at least as a first area of attack. The vast majority of patients who are infected do run a fever, so 90% of the time, if you have an active infection, a fever will occur. The cough, which is linked to the coronavirus, is more of a dry cough, a deep cough, and that is because this is not like a bronchitis. This is an inflammation that is occurring within the lungs, and so that's why the coughing is more of a dry and of a deep type. And then this is linked frequently with a really significant increase in malaise or tiredness. A main thing to be aware of, at least certainly outside of the United States, symptoms that would resemble having a cold or a flu usually do not occur. So it really is a little bit different. There isn't like a runny nose or the typical flu-type symptoms. This is really rather a different pattern of symptoms. If we go to the next slide, what I've listed here is what I think is really the key thing for patients with myeloma right now. Now, just to be aware, this is the first time that I have ever written a blog 3 weeks in a row on the same topic. So for the last 3 weeks, I have written a blog about this COVID-19 coronavirus. And I wrote the most recent blog on Thursday, but I also had blogs in the last couple of weeks in which I've given a lot of detailed advice for patients. And the key point right now is that since there has been a limited access to coronavirus testing right now, the big dilemma actually for all of us in the US is that we have very little knowledge about who might have infection or have been exposed to infection and who does not. And so this really makes it very, very difficult to know among your friends or family or contacts who might be putting you at risk for possible infection. And so this notion of what is called on slide number 7, social distancing, is really quite important. And for myeloma patients who are definitely what one could call vulnerable, myeloma patients have reduced immune systems. Because of the various treatments that we use, the immune system can be further suppressed and the white count can be knocked low by treatment. And so this is a particular problem, especially since myeloma patients may be more elderly, the average age being above the age of 65. And so this is not a time to be cavalier. This is a time to be staying home for now. To avoid infection, hand washing, very important, and avoid touching your face if you feel that you may be in an area where there could have been surfaces or contact where infection could have been lurking. Contact can be with through your eyes or your nose. It's good in areas where there may have been a surface contact to avoid touching your face. Wherever you are at home or traveling, clean the surfaces, including your cell phones and computer or iPad screens. And strangely enough, although we all love and trust our family and friends, it is a good time to be asking them where they have been most recently. Did they go on vacation? Where have they been? We just need to be cautious about whoever we are in contact with and who our friends and family have been in contact with. This is the time to call your doctor, not to run into the doctor's office where there could be other individuals who may have had exposure to the virus. Also, large hospitals and clinics are really not the place to go. It's important to be in touch with your doctor by telephone or online. This is what we call the time for telemedicine approaches, where lab work can be logged into the central computer and you have your computer code and you can access results and either talk on the phone or get information by email. I would emphasize that right now it's good to have been in touch with your treating doctor, to have a plan of action, to coordinate your ongoing treatment, to make sure that you have refills for all the different medicines that you need on hand. And then also, if you have a fever, a cough, or are feeling extra tired, what is your doctor going to recommend, and have kind of a plan of action formulated ahead of time. And so those are just a few immediate suggestions about this virus. And so I think that what I'd like to do now is go to the panel for a question and answer with the panel. And so if we can start with Paul, maybe you'd like to comment on what the impact has been for the coronavirus in your personal practice, or if you have personal suggestions or comments. Paul?
Thank you, Brian. That was an excellent summary you gave, and I really appreciate it because I think it's incredibly important. In Boston, unfortunately, we do have a very active situation because of the spread that originated from a Biogen meeting at the end of February. It's important to note, however, that the issues that you alluded to do seem to be so important. Social distancing, self-isolation, exquisite attention to barrier precautions and protection from transmission. I think in terms of what we've seen so far for our patients, I'm pleased to report that so far in my practice, there has not been a case of COVID-19 infection.
Okay, wonderful.
Yeah.
Fingers crossed, yes.
Yeah, and if I may, Brian, a couple of things I'd add is that I think obviously patients are being extremely careful and their loved ones as well. And I think that the important message is that, just as you outlined, which is this social distancing and obviously having a clear plan of action if symptoms emerge.
Okay. All right. Well, thank you for that. And so, Rafat, any words of wisdom on your side? How is it impacting practice in Indiana?
Well, I think we are in a similar boat like everybody else, so we have to be careful. And, social distancing also will include, do you have to go to see your physician at this point? So routine follow-up, we're trying to avoid. If you're just on bisphosphonate and coming for your monthly, infusion or shot of denosumab, Exgeva, it's okay probably to delay it a month. So unless there's a serious medical condition that requires in-person contact with your physician, we're trying to avoid right now. And obviously we need to, figure out the timing of transplant. If it can be delayed a couple months, that's okay. So social distancing in all format is very important.
Right. Very, very good points. And Yelak, from your patient advocate extraordinaire perspective, what thoughts come to your mind?
I think I want to mention a couple of things. This is a prime time for internet scams. So make sure that you exercise extra diligence when opening messages from people you don't know, emails, links without verifying the sender. Don't open attachments, all that things, because we don't want to be scammed during this time of need. And the second point is I think there is a mental aspect to coronavirus as much as there is a medical aspect to it. Patients get anxious. we lose similar when we were first diagnosed with myeloma, a sense of losing control with social distancing, being further isolated as a cancer patient. And as Dr. Abonour mentioned, there may be disruption of our treatment protocols, especially if you live away from a cancer center or take public transportation. And a lot of concerns around what do I need to do if I am on a clinical trial that is very strict and regimented.
Right, that's a very key point actually, and so this should be discussed with the trial doctor as soon as possible to have a strategy to, if treatment has to be given, perhaps go in at a quiet time, maybe even in the evening or something like that, where there would be the least chance of exposure. So things like that.
Yes, Brian, and if I may, Yelak makes an excellent point about clinical trials. We're actively pursuing a strategy for those folks in long-term follow-up, say, and maintenance of clinical trials, of being able to not have them necessarily travel to the center, that we can do as much remotely as we possibly can. And our IRB has been very understanding of this, actually, and very clear that that this is a very appropriate response to the emergency. So therefore, we're doing that actively and helping our patients accordingly. And I think the most important thing for patients, as Yelak so nicely points out, is their treatment is consistent, it's under control, and it will continue. And you're absolutely right, Rafat, that there could be interruptions in treatment that may have no consequence. There's a few weeks delay here or there. Say someone who's been treated for the last 2 years or so on a maintenance strategy, a few weeks delay in lenalidomide therapy is not going to change outcome at all and could actually be perfectly reasonable to do.
Right. But these are things that, as you mentioned, Paul, need to be done in concert with the IRB, who I think can give immediate guidance and help on that. Okay, so we do have quite a number of questions that have been listed in the question box. There's one question about daratumumab. As you guys know, with Dara, over time there is some immunosuppression and some risk of infection, and the question is about the continuation of Dara in this current setting. And I think my answer to that is obviously there is some increased risk, but we do have that with a range of myeloma treatments. So probably the most important thing is to continue with the treatment, but certainly to discuss it with your doctors. Any particular thoughts about daratumumab from you guys?
This is Rafat. I mean, obviously the concern is with daratumumab is really reduce normal immunoglobulin. I'm not sure it affect your cellular immunity that much. So I think everything we do in medicine is risk and benefit. And if the drug is important for controlling your myeloma and preventing, progression, I think one need to continue with that. We are in the maintenance phase of treatment with daratumumab.
Right.
Maybe we can, a month, who knows? But I think it's always risk and benefit. You need to understand, if you lose control of your disease, sometimes that's hard, to establish control. So you need somebody to discuss that with details with.
Yeah,
absolutely.
Brian, I would very much echo Rafat's comments. I would stress, though, the point that daratumumab is associated with suppression of uninvolved immunoglobulins that are very important in bacterial infections. But Rafat's quite right that in the context of cellular immunity and in the context of antiviral effect, that we've no evidence that Dara would accelerate a viral process, except, of course, people have to be on acyclovir when they're on daratumumab for the herpes virus to prevent shingles reactivation. But I think Rafat touched on an excellent point, Brian, which is about IVIG, which is being often used for our patients who are on daratumumab therapy to replenish their uninvolved immunoglobulins, and that may be very helpful.
Right, right. All right. So there are a number of other questions, some practical ones. This actually came up in our office the other day, which was how do we make sure that packages and things that are coming in the mail are safe? And I don't know if anyone wants to comment on that. We got some mail and packages coming from Asia, actually, and how did we feel about that? Anyone want to comment on that?
I heard
one?
on NPR that on a cardboard the virus can last 24 hours, on a stainless steel is like 72 hours. But those are in a lab where everything is under control. But I guess the question is if the travel, and the temperature change and all that stuff. It's hard to know what to do. I think if you get a package, don't open it the same day. Open it tomorrow. Clean it up before you touch it.
Or wipe it down. I would certainly consider wiping it down. Someone on the line says maybe they would freezing food packages kill the virus. I think probably yes. Maybe stick them in the freezer for a while. But I think washing off is a good idea for sure.
Yeah. My understanding.
Another question which relates to the social distancing, and I think is an important one, with local travel domestically, a patient is concerned about hotels and restaurants. Does anyone want to comment on that?
Well, our advice, Brian, for our patients has been to minimize that as much as possible, and essentially it's all part of this whole construct of social distancing. And I think it's unfortunately you don't have control over environments like that. You don't know who's been there before, and whilst obviously in the context of restaurants and so forth, being socially distant from someone next to you on a table is appropriate, the issue really becomes restaurant workers and so forth. So we're being very, very cautious with our patients and advising, really stay at home. And I think that's a reasonable message given where we are with things. I just wanted to add a point to Rafat's comment about packages. I completely agree with you, Brian, that these should be wiped down. In terms of the temperature sensitivity of the virus, it seems to prefer temperatures around 49 to 50 degrees. It's quite heat labile. Once things get hotter, that's lethal to the virus. And I believe also freezing temperatures from my ID colleagues are obviously also deleterious to it. But I think those are all very sensible precautions around minimizing the risk of transmission.
Right. Very good. Yeah. I think that this idea of not going to restaurants and really not even traveling locally if you can avoid it, and stocking up with food that you need at home, and remember that food can be delivered, and that might avoid going to the grocery store. I have to say that I was pretty amazed how busy it was at the grocery store, and possibly not a good place for social distancing, that's for sure. And there are a variety of ways of maybe getting food delivered, or just avoiding places that might offer a risk of exposure.
Dr. Durie, this is also a time, I think, to come together as a community. In our neighborhood, for example, there was a post on Facebook, neighborhood community Facebook, where someone wrote, if you are uncomfortable or not healthy enough to go to a grocery store or pick up your medicine, I would be glad to do that on your behalf. So taking advantage of neighbors while exercising social distancing may also make us a more cohesive neighborhood and community.
Absolutely. I think it's
very well said.
Yeah. Absolutely. I think it's good to come together and try to help each other. And that applies to, just to be aware that younger people can get infected and are much less likely to have serious problems. However, they can pass the infection along, and so it's important for everyone to pay attention to these social distancing ideas. There's a question to come up on the screen here about going to the gym. I think that my personal feeling is it's probably not a good idea to go to the gym where there are so many surfaces that could be contaminated. Someone wants to go swimming at the gym, I guess that might be okay, but with some caution.
I completely agree, Brian. We are encouraging our patients not to do that. It's obviously humid, it's sweaty, there's secretions. It's really not a good idea. I think you're absolutely right, Brian, there. Again, I think this is a time to echo Yelak, of staying at home and pulling together as a community.
Right. There's several questions about stem cell transplant. As Rafat, a couple of people mentioned, if there's a scheduled autologous stem cell transplant, it's a good time to talk to the doctor about delaying that for a couple of months. If you have had a stem cell transplant in the recent months, then important to talk to your doctor carefully about supportive care, because there is a risk until your blood counts and immune system have a chance to recover in these coming months, and so definitely good to talk to your doctor if a transplant had been planned and if you have had one in the recent past.
Dr. Durie, how about vaccinations after a transplant? And you have had a transplant and you are due for a vaccination. Should you delay that?
I would be inclined to delay it. Yeah, there's a question that popped up on that. Yes.
Yeah.
Sorry.
So vaccination usually starts about 6 months post-transplant. If you just had an immediate transplant, I mean, I think, if you practice social distancing, it's, fine. I don't think you are at increased risk because you had, if your white counts recovered and the only thing I would like you to do is, really avoid crowds and avoid, having to go to the hospital unless it's absolutely necessary. And most hospitals and clinics now following better, isolation procedures and protection of the patients. So I don't want anybody who had just had a stem cell transplant to be alarmed. I mean, I think, just follow what they taught you after you leave the transplant. Wash your hands. Stay away from sick people. Don't go to church.
Right.
Don't go to restaurants.
All of that.
You will
be excellent. Yes.
Sorry, Brian, I just would emphasize, I really think it's important, this construct of social distancing for staying at home, because I really think that you're absolutely right, Rafat, for reasons that are obvious, church, synagogue, temple, all of these things are not to be done. And we really hope, obviously, the timeline of this will settle down over the next coming 1 to 2 to possibly 3 or even 4 months, but nonetheless, this will pass. And I think that the important point is that people maximize their chances of not being exposed.
Right. There's a question here which is a tricky one. Someone asks, what if a family member has recently returned from a trip? What should be done? And this is really a tricky point right now. The ideal thing would be for such a person to have a coronavirus test, actually, so that everyone would know if that person might have picked up the virus along the way. And so that would be a good option. Hopefully that might become feasible within the next week or so as the amount of testing available increases. I was pleased to see that a method from Roche will be made available in addition to a variety of other state lab tests will be available. And so hopefully it will be possible for more individuals to be tested, which would allow families to try to stay safe. If you don't know if a family member who has traveled or maybe went to the synagogue or maybe went to a concert or something like that, and you're worried, it would be ideal to have that testing done. Otherwise, you need to, even within the family, consider a degree of social distancing.
Brian,
any thoughts on that from anyone?
Yeah, Brian, I would echo that. I think what we have to be aware of is that the testing issue is complicated, and I think there's been a certain politicization of it, which is unfortunate. But the reality is that there can be false negative tests depending on the viral burden. So I think it's terribly important to understand that, and it's terribly important, again, I think safety first. If someone has come, a family member, again, you 2 or 3, 4 months from now, you can see them as much as you like potentially. The issue is now, and I would exercise extreme caution because, again, these tests can be false negatives. And this has been clearly shown in the Korean experience that patients have started off negative, converted to positive, and so forth over time. The most accurate technique is from the bronchoalveolar lavage, and that's obviously in the setting of someone with the acute respiratory distress syndrome.
Right.
Intensive care.
So I echo Paul, comments. I think it's very important to consider the 14 days isolation if that's the case, somebody coming from Italy back or Spain. I think stay away from them for 2 weeks is not going to hurt anything. You're going to, as Paul said, you're going to do everything with them in 5 months from now.
Yes.
Right, exactly. So there's a question which is kind of the opposite, which is someone is saying if the myeloma has been relapsing recently and some new treatment is necessary, what should the patient do? And I do believe that that's what Rafat was talking about, that balance between managing the disease and trying to avoid risks. I think that the new treatment probably should be given, even if it might be intensive. The number one thing will be to control the myeloma, and this needs to be just organized in as careful a way as possible with the center and with the doctor to go in to get the treatment, but also to practice the social distancing. So I think that, I don't know if you guys have been doing this yet, where you might have people come in late in the day or even into the evening to avoid any crowded spaces. But I guess you might be open to that, right?
Rafat, do you want to comment first? Yeah.
No, go ahead, Paul.
Yeah, we certainly are already, Brian, because obviously we have a confirmed outbreak in Boston, and so as a result of that, we've been practicing exactly what you're describing, and at the same time maximizing precautions. And obviously, if a patient's disease is active and requires therapy, everyone is at all hands on deck to help. But exactly what you're saying, Brian, keeping patients synchronized in terms of timings, maximizing social distancing, and exercising all the usual precautions around therapy. I wanted to add one thing, if I may, Brian. I don't know if it's one of the questions, but one thing advice we're giving our patients is that if they're on Revlimid, for example, and they develop an upper respiratory tract syndrome, we are advising patients who are on Revlimid or on POM, or in other words, an immunomodulatory therapy, that it's wise to hold the Revlimid or wise to hold the POM, because we know that these things are immune modulators and can exacerbate an immune response. So if a syndrome is emerging and there's a concern, it's always wise to hold your medicine and obviously discuss with your physician. But that's certainly our strategy, has actually always been the strategy with Len maintenance and POM, for example, but is particularly important potentially now.
Okay, good points, Paul. Very good points. Another question relates to the risk for patients who have smoldering myeloma, I guess, or possibly MGUS. And I think that even in the evolving stage of the disease, we've been learning more and more that such patients are immune compromised, and so I think that I would certainly have due caution, even for a patient with smoldering myeloma or MGUS. Obviously, the big thing for such patients is that mostly they would not be receiving active therapy, and so there would not be that added risk of immunosuppression and low blood counts related to that. But I think that, again, due caution for patients with smoldering or MGUS. Any thoughts there, guys?
No, just like anybody else. I mean, I think it's very important. You know, every person in this country, until we figure this out, social distancing is very important.
Right,
yes,
right.
I would echo that,
There's
and
nothing
I
to
think
do about smoldering or mucus other than social distancing right now.
And
Exactly.
exquisite care regarding hand washing and so forth. Yeah.
Right. And there's a number of questions related to age. I think that what we're learning is that the infection is occurring for patients who are younger. It's just that the risk of more serious complications goes up with age, particularly into the 70s and the 80s. It does seem, for example, in Italy, the big problem is that they have had a high impact on the elderly population of Italy, which there's a lot of elderly people in Italy, and so this has had a unfortunate impact on the effect of this disease in Italy, where there are so many people in their 70s and their 80s, and so the age is definitely an important aspect of this whole outbreak.
Yes, I would concur, Brian. I think an important point, though, is to realize that obviously the severity of the syndrome does occur across younger people as well. Their capacity to recover, obviously, is a key point. The good news is that it doesn't affect children, amazingly, although children can be infectious. The other piece of this is that, as you mentioned earlier, Brian, in 82% of cases so far, there is a mild to moderate illness. And this subset in whom problems occur is obviously, thank goodness, a minority. But the challenge, of course, is the extent of it. There is some important information to share about ACE inhibition and hypertensive medication. That ACE inhibitors upregulate the so-called ACE2 receptor in the airway, and this apparently is as a target for the virus. So this is something to discuss with the local physician, your caregiver for your high blood pressure, because certainly if you're on an ACE inhibitor, this is worth thinking about, because obviously if there's an alternative medication for high blood pressure that can be safely used, being off your ACE inhibitor may in fact turn out to be a wise move. Again, not something to be done without careful discussion with your care team.
Right, that's a very good point. Yeah, the coexistence of hypertension, diabetes, being somewhat overweight, a number of these things have for various reasons, impacted the problems with coronavirus infection. Okay, well, I think that we've really covered a lot of ground on this, and certainly we could come back to it if urgent questions come into people's minds. So unless people have some final thoughts, maybe we can move on. Any final thoughts about this COVID-19 issue that we're all faced with, or perhaps we can move on now?
Brian, my only comment would be one of great honest optimism. I think we will prevail through this, and I think for the myeloma community there is every reason that we can be very hopeful, recognizing all the caveats and precautions and the challenge, which is tremendous. One very interesting snippet to share is that, interestingly enough, preclinical data suggests that proteasome inhibitors, boronate peptides in particular, have an antiviral effect. It remains preclinical, but clinical trials in China are actually being launched with bortezomib for the treatment of COVID-19. So not that I'm saying that bortezomib or ixazomib will fight this disease, we simply don't know that. But it's, I think, just a word of a hint of a word of hopefulness for our patients as well, just to bear in mind some of these, I think, important things that we can do that I think will get us through this.
Absolutely. So let me just echo that. I think that it's very good to see right now that despite the huge problems in Asia, in China, in Korea, and Singapore, the number of new cases per day has dropped dramatically. And so it does seem that the wave of new cases passes through in a span of about 3 weeks, it seems like. And so the peak of problems is a very, very acute phase of about 3 weeks, which unfortunately that's where we are right now. But 3, 4, 5, 6 weeks from now, we could be hopefully looking at a time where the risk of new infections will have dropped to those levels that are occurring in Asia now. Another piece of good news is that even for patients who get very, very ill, the kind of shock syndrome that occurs in some people who get extremely ill, it seems to be something like a cytokine release syndrome, and can actually be treated with medications that we have recently been using related to CAR T-cell therapy. And so anti-IL-6 medication, what we call tocilizumab, and also steroids can be useful in that scenario, so that despite the fact that we don't have a proven antiviral approach, there are some good supportive care measures that can get sick people through the crisis point.
Dr. Durie,
okay.
One practical comment to mention is this may be a good time to double check, you know, you have your will, you have your medical power of attorney, what to do with your loved ones if you are unable to care for them. And I don't mean just children or healthy husband or wife, but also pets, animals, plants. And you as a patient, what do you do if your caregiver is quarantined and unable to care for you? So this may be a time to plan for that when you don't need to actually have that.
Right. Yeah, it's a good time. At home, when we are quarantined, it's a good time to think about a lot of these different things that possibly we should think about more carefully in the big picture anyway. Yes.
All right. Brian, there's just one other thing, I'm so sorry, it was just a very important positive, which is, as you may know, some of the antivirals that have been under study have been showing considerable promise as well. So I think patients should really know that there are some effective antivirals that are in the clinical trial pipeline moving very quickly, that certainly preliminary information suggests benefit. So very important for patients and families to hear that.
Absolutely. This retroviral from Gilead, for example, has shown actually quite promising results in China and I think elsewhere. And I think that we should look to see if this can be made available on a trial basis in the U.S. as needed. I haven't heard of anyone being able to have access to it yet, but hopefully that can happen.
No, it is. Brian, just to reassure people, it is. There was a case report just published in the New England Journal of a man in his middle 30s who had a full recovery from the syndrome, and he received the antiviral therapy on a compassionate emergency use basis. So there is access.
That was good. Yeah, was that the gentleman up in the state of Washington? Yeah.
Exactly.
Yeah, that was. Yeah, there was a gentleman in New York, the lawyer in New York, who was trying to get it, and so I was tracking that to try to see if that might happen. And so hopefully there can be access for people who really need it.